We welcome you in our YouTube channel RTeamCreations. As you know, we come with health topics to make our society healthy. So in the same series, we are going to talk about child psychology with our expert Dr. Hemika Agarwal. What is child psychology and why it is important to understand?
Child psychology deals with the psychological issues and especially the developmental issues faced in children. It pertains with many disorders as well which children are prone to in their developing years. Obviously, as from the definition we can gauge, it is important because the disorders which usually occurs or the problems faced by a child during the developmental years, if not addressed timely and aptly, they can lead to long-lasting damages, and it can have an effect on the entire adult life of the child, entire life of the child. And some problems, if nipped in the bud in early stages, can prevent a lot of morbidity and improve the functioning of a child and improve the quality of life.
Which age of children need to go to the child psychologist?
See, WHO defines child as a person being in the age gap of less than 18 years. Sometimes when pediatrics is concerned, they take children up to 12 years only, and above the age of 12 years, physical illnesses are at times taken up by physicians, general physicians who treat adults. But when we refer to child psychology, we do not stick to the criteria that definitely, that strictly, because as we can imagine, the moment a person turns 18, it isn't as if all the problems will change or the person will change entirely. These things, psychology and psychological issues, they fall in a continuum, and these problems, they grow, develop, wax and wane gradually on a continuum rather than in a discrete manner. So as the child grows from birth to 18 years, the problems at every phase of life is different. The problems addressed by child psychology and psychiatry are different, and it depends basically on the range of the age rather than the exact age itself.
How child psychologists can help the children for their development?
See, if a child is developing usually or as they call normally, then there is no need to consult a psychologist. But if the parents or the guardians feel that there is some problem, if the school authorities, they pick up some problem in the child, some deviation from other children, some deviation from the expected pattern of development, in that case, a referral to a mental health professional, usually trained in child psychology and child psychiatry, is warranted. Problems, I think you were mentioning about the problems faced and the problems which can be addressed by child psychologists and psychiatrists. They would refer to majorly developmental and delay in milestones. Milestones are the activities a child gains at every stage in life, and we have after research, science has found grossly the age ranges at which the various activities like walking, talking, sitting, etc. can be achieved by a child as the child grows. So if a child is delayed or is falling behind the other children in gaining the milestones at an expected range of time, then we call that developmental delay in milestones. Such problems can be addressed by a person trained in child psychology and psychiatry. The cause of delay in milestones can be evaluated, and the disorder, if any, can be treated. Any behavioral issue in the child in any phase, from birth to till late ages, like till 18 years, that can be addressed by child psychiatry, child psychology, like irritability, loss of appetite, having physical symptoms, yet the physician or the pediatrician telling the parents that there is actually no physical issue with the child, like refusal to go to the school, or if a child complains of persistent stomachache, yet the physician says, a pediatrician says that there is no physical issue with the child. It could be stemming from psychological problems in the child, and these should be addressed by mental health professionals trained in child area.
Is there any red flag sign to identify the children by teachers and parents?
See, parents are not trained in child psychology or psychiatry, and we do not expect them to be. Their job is to detect the possibility of some problem and for confirmation to take to a health professional, and it's the job of the health professional to diagnose and treat. But if the parents have a doubt, see, we can increase their awareness so that they can pick up these disorders and the possibility of these disorders and take the child to a psychiatrist or a psychologist. As we discussed, milestones is one of them, and the expected behavior of a child during the developmental years through puberty to adulthood as expected, this should be taught to a parent. And if there is any deviation from the expected pattern, then it's the duty of the parents, teachers to pick that up and bring it to the attention of a professional. Learning about the milestones and the expected ages at which the different milestones are expected to be gained by the child is enough, and it can give a hint to the parents and the teachers as to whether there is a problem with the child, and they are the checkpoints which they should be aware of. And if there is a problem in that, then they can go to a psychiatrist, child psychiatrist or child psychologist. I'll give you some examples, few examples only. That neck holding, like one might think that an infant few months old may not need a psychologist or a psychiatrist at all, but you will be surprised to know that problems in milestones can be detected as early as 3 months. A 3 months old child is expected to start holding his neck without any support. If a child overshoots the 3-month period and yet is not able to hold their neck, then that person should be taken to a health professional, because there could be n number of reasons for delayed milestone. Sitting is usually achieved at 5 to 6 months. First sitting appears with support and then later without support by approximately 5 to 8 months. If this is delayed beyond that, it needs help. Walking is usually achieved firstly with support and then without support between 11 to 13 months. Different books give different values, but this is the major range which we consider acceptable. If walking is delayed beyond that, then that should be no more. Speech is very important when it comes to psychological disorders. Many psychological disorders like mental retardation, autism, and global developmental delay, they can be represented by a delay in speech. Speech is usually, like bisyllables can usually be achieved by 9 months, but proper sentences are achieved at 2 years of age. So if there is a delay in these, we should suspect some problem in the child and take him to a professional. Toilet training is achieved by 3 years of age. Unbuttoning of the clothes is achieved by 3 years of age. Even some motor skills like drawing a circle can be achieved by 3 years, and drawing a triangle by 5 years. So if we are aware of these things, we'll be able to pick up the problems also and take the child to a professional early.
How one should decide that child needs the help of psychologist?
If there is a physical problem with the child, like the child has say loose motions or fever, nausea, vomiting, then the child should be taken to a pediatrician. But if we feel that there is a problem in the behavior of the child, if he is not coping with the milestones are not in sync with the milestones of other children, then we should we should consider the possibility of psychological disorders, psychiatric disorders like intellectual disability, which was priorly known as mental retardation, or say autism, which is a communication disorder. And in that case, if behavioral changes are there, milestones are not achieved, if the child is aggression, the child is withdrawn, in those cases we should take to a psychiatrist or a psychologist. And usually they work in a team. One also fears going to these professionals for the fear that such young children should not be administered psychotropics or psychiatric medications. But this is the duty of the treating team, which usually includes a psychiatrist, psychologist and other people, who determine under the medication is supervised by the psychiatrist if needed at all, treatment is done in collaboration with the whole team, and if the child needs medication, only then would they be given medication. If not, then therapy is given. Alone it can also be helpful in many cases, but one should not fear that if they take a child to a child psychiatrist, then the psychiatrist would impose medications on them. No, the child will be first evaluated whether the child needs it or not, and only then we'll administer medicines.
This is due to genetic disorder.
You asked me if the disorders of childhood, psychological disorders of the childhood are genetic. Many disorders, see, mental retardation can be present in many genetic disorders. It could be because of many non-genetic disorders as well, but genetic disorders have a huge propensity and a huge contribution to mental retardation. So a child presenting with mental retardation should ideally be investigated or evaluated for genetic disorders also. A thorough family history should be taken, and if the parents are planning further children in the future, so their genetic counseling is also advised, evaluation and counseling, so that some genetic problems which are leading to mental retardation in the first child do not repeat in the second child also. There are many tests which can be done while the mother is pregnant, which can determine whether there is a genetic anomaly which can lead to mental retardation after the birth of the child. So yes, many disorders, psychological disorders like mental retardation can have a genetic component.
Could you give some message for our viewers?
Yes, many problems faced by children which are psychological in nature can be treated, can be managed, can be addressed, and if we address them timely, we can save a lot of problems in future, and we can nip these problems in the bud and prevent the child from having a miserable life ahead. And if we help the child timely, we can prevent a lot of morbidity as well. So please do not fear going to such health professionals just because of stigma, and for the sake of your child's health, seek help when needed.
In case you have not subscribed our channel yet, then subscribe it now and share it with your friends, and click the like button if you like the information. Thank you.